In the previous video, we completed the part 1 of the digestive system pathology. Now, in this video, we will discuss the part 2 of the digestive system pathology and the first pathological condition, that is bloat. It's also called as tymphanitis. There are some physiological considerations are there. Normally, the gases which were produced in the rumen are get rid by the process of eructation. If the process of eructation impedes and leading to the accumulation of the gases in the rumen, that is ultimately leads to the bloat. And the saliva, which has an important anti-foaming property, that is saliva contain a mucin, which prevent the formation of froth. If there is any secretion of saliva get reduced, and in such condition, the process of formation of froth will be increased and ultimately leading to the bloat. So saliva and the process of eructation plays an important role in the bloat and tymphanitis. Now let us come to the etiology. Accumulation of gases may occur because of the rapid production of gases as compared to the less reduced eructation of the gases. And whenever the eructation mechanism become a defect or faulty, and such condition, the gases were entrapped in the rumen itself, leading to the bloat. And now let us come to the types of bloat. Based on the duration, that is nothing but the course, the bloat may be classified as acute and chronic, and based on the nature of gas, what type of gas which is present inside the rumen, and based on that, the bloat may be classified as dry and frothy. Now let us look at acute bloat. Acute bloat may be due to complete choke in the esophagus, and this may be due to sudden change in the feed and excessive feeding on legumes. And in case of a chronic bloat, it occurs whenever there is any hindrance to the eructation in the esophagus, and it may occur in the lesions of a rumen, causing a decreased contraction of the ruminal wall, as in case of atony and serosal adhesions, paresis, diffuse lymphomatosis. In such conditions, the contraction of the ruminal wall will be reduced, ultimately leading to the accumulation of the gases inside the rumen, leading to the chronic bloat. Now let us come to the dry bloat. Dry bloat is less harmful, and the gases can be more easily get rid by the process of eructation. And the frothy bloat, here the formation of froth will be there. In this bloat, the gases are trapped as small bubbles in the fluid, forming a foamy mass which is not easily erected. Now let us look at the etiology for the frothy bloat. The saponin, which is present in the plants, is a good saponifying agent that leads to the formation of froth. And the water-soluble proteins of the legumes are capable of the formation of froth. And the factors, those factors which facilitate the increase in the viscosity and lower the surface tension of the ruminal content are able to produce froth. So inside the rumen, due to bacterial activity, fatty acids are produced. These fatty acids are capable of increase the surface tension. If the production of these fatty acids is decreased, and the surface tension will be lowered, that favors the production of froth. And this is the theory behind the use of vegetable oils in the treatment of bloat. The vegetable oils which were we used in the treatment of bloat, those will convert themselves into fatty acids. And these fatty acids, we all know that these are capable of increasing the surface tension of the ruminal content, leading to the getting rid of the bloat. Now let us come to the pathogenesis. Some legumes contain hydrogen cyanide, which is toxic, which cause the paralysis of ruminal and reticular musculature, so it inhibits the process of eructation. And some legumes contain phosphatase, which is enzyme. With the help of arsenate, it accelerates the process of fermentation, leading to the production of large quantity carbon dioxide. The gases like H2S, carbon dioxide, carbon monoxide, which are produced in large quantity, which again cause the paralysis of the ruminal muscles. The paralysis of the ruminal muscles ultimately leading to the loss of the contraction by the muscles, and thereby the gases which were produced in the rumen are unable to escape from the rumen, ultimately leading and trapped in the rumen, leading to the bloat condition. And the animals which are excessively fed on the green plants only, which do not contain sufficient fiber, and the mucosa of the rumen is not adequately scratched to elicit the reflex contraction of the musculature. And mechanical stimulation of cardia, especially by the raphages, increase the rate of secretion of saliva. But with the ingestion of young succulent legumes, these young succulent legumes are unable to stimulate the production of saliva, so the little saliva may be secreted Thereby foaming is not counter-reacted and the bloat will results. Inside the ruminal microflora, mucinolytic bacteria, these bacteria which are capable of destroying the mucin which is present in saliva, which is act as an anti-foaming agent. If by the action of these ruminal mucinolytic bacteria, the salivary mucin concentration will decrease and thereby leading to the production of frothy bloat. And whenever there is any interference with the nerve pathways that are responsible for the erectational reflex, leading to the tympany or bloat. And the distance rumen compress the other abdominal organs. Because of the distance rumen, the organs which are present besides the rumen inside the abdomen, and those organs undergo compression, which cause the passive congestion, since the pressure on thin-walled veins impedes the circulation. Along with this, there is a forward thrust on the diaphragm that is leading to the pressure on the lungs, which become smaller and sometimes lactatic. The result of this is hypoxia and ultimately leading to the asphyxia and death. Now let us look at the gross pathology. Animal may die because of bloat. Besides the congestion of the abdominal viscera, one may notice the hemorrhage on the pleura, pericardium, tracheal mucosa, and on bronchial lymph nodes, as well as in the lymph nodes of head and neck. The blood is tarry colored, as in case of anthrax. The liver is pale in color. The rumen or diaphragm may be ruptured sometimes. Within few hours of death, the ruminal epithelium fills up. The sequelae, if quickly relieved this bloat condition, acute bloat can be cured, and if not, the death may occur due to asphyxia, and it can be prevented easily by liberal feeding of hay and straw to the animal after the feeding of succulent legumes. This is about the bloat. To summarize the bloat, consider these physiological elements. Those are the process of erectation, and another one is the saliva, which contain mucin, which act as anti-foaming agent. If there is any defect in the process of erectation and the secretion of a saliva decreases, leading to the bloat or tympany, and its type has acute, chronic, and dry and frothy. And in pathogenesis, hydrogen cyanide, which is toxic and leading to the paralysis of the ruminal and reticular musculature, and the acceleration of the process of fermentation leading to the large quantity of carbon dioxides, and the excessive feeding of succulents, those feeds which lack the sufficient fiber, those are responsible for the production of gases in the rumen itself. And the ruminal mucinolytic bacteria, which are capable of destroying salivary mucin, thereby helps in the production of froth. And ultimately, the distance rumen, which compress the other abdominal organ, leading to the passive congestion in the abdominal wall. And there is the forward thrust leading to the pressure on the diaphragm, ultimately on the lungs, which become smaller and leading to the asphyxia and death. The grossly, animal may die. Besides, there is the congestion on the abdominal viscera and other organs, and the pleura, pericardium, tracheal mucosa, and other lymph nodes, and the liver become pale in color, and the blood is tarry, as in case of anthrax. The rumen and the diaphragm may be ruptured because of distension, and if it is treated quickly, acute bloat may be cured, and if not, the death may occur due to asphyxia, and it can be easily prevented by liberal supplication of hay and straw whenever we are feeding the succulent legumes. Now let us come to the impaction of the rumen and reticulum. In this condition, rumen stops functioning. The musculature of the rumen does not contract, and so the food ingested remains stagnates inside the rumen itself. It is common condition in the cattle, and the predisposing causes are lack of exercise and debility predispose the animal to atony of the rumen. Atony of the rumen is nothing but the lack of tonicity of the rumen. And now let us come to the etiology. Overfeeding with large amount of highly fermentable carbohydrate feed and tight packing of the rumen leaves no room for the bacterial growth and normal ruminal fermentation and digestion. This leads to weak contraction of the ruminal and reticular wall, and so the food does not get propelled out. The lack of water, defective mastication and salivation, penetration of the wall of a rumen or reticulum by sharp objects, the paresis of a rumen which may occur due to injury to vagus nerve by pressure from the abscess, tumors and other defects. Now let us come to the pathogenesis. Pathogenesis of atony and impaction of the rumen after ingestion of a large quantity of carbohydrates. The carbohydrates are fermented by gram-positive organisms, notably Streptococcus bovis, which a fermentation of these carbohydrates leads to the production of lactic acid, which results in the lowering the pH of the ruminal content. The normal pH of the ruminal content is 5.5 to 7.5. If the increased fermentation leads to the lowering of the pH of the ruminal content to low as 4 to 4.5. In such condition, the normal ruminal microflora does not exist. Due to production of lactic acid, the osmotic pressure of the ruminal content increases. So, the fluid are drawn into the rumen from the blood, leading to hemoconcentration, anuria, dehydration, and circulatory collapse. Because of this high production of lactic acid, the osmotic pressure of the ruminal content increases. Thereby, it will draw the fluid which is present surrounding to the rumen from the blood that will leads to the heme concentration, and which are fluid are drawn from the urine, ultimately leading to the anuria and dehydration and circulatory collapse. As the pH of the ruminal content falls, the motility of the rumen decreases. Thereby, it will lead to the complete stasis. At a lowered pH, the normal microflora of the rumen are destroyed. The lactobacilli and streptococci thrive and salivary secretion ceases, so that the buffering action of saliva is also absent. Absorption of lactate which causes acidosis in the animal. Now, clinically, the food is stagnated in the rumen. If it becomes putrefied, leading to the liberation of foul-smelling gases. In some animals, diarrhea may be present. If the putrid ingesta finds its way into the intestine, which again causes the enteritis, anorexia develops and regurgitation stops. Grossly, at necropsy, the rumen will be found to contain hard, caked, undigested food with evil smelling odor. In animals that die of acute atony, the content of rumen and reticulum are thin. They look like bulky. The cornified epithelium is soft and fills up easily, exposing the hemorrhagic area. The blood is dark and thick. Lungs show bleeding into alveoli and bronchi. Heart musculature become flabby. That is nothing but musculature of the heart become soft. And histopathologically, if the animal survives for 3 to 4 days, there is deamylation of the nervous system may occur. Histopathologically, if animal survives for 3 to 4 days, and in such condition, demyelination of the nervous system may occur. The sequelae, in mild cases, if the primary cause is removed, the normal state may be regained. In severe cases, toxemia that will cause death, enteritis, peritonitis, and ketosis may be noticed. Now, let us look at the another pathological condition that is very important, that is traumatic reticulitis. Traumatic reticulitis, which is a very common condition in older cattle. Pathogenesis involves these animals ingest and swallow along their feed a wide variety of sharp objects like needles, nails. Sometimes the contraction of rumen and reticulum during the pregnancy cause the sharp object to pierce the wall of the reticulum. Usually, it pierces the anterior ventral wall, which is near to the diaphragm, and the passage through it is usually slow, and so the tract formed by these moving snail is thickened by a dense fibrous wall. And piercing the diaphragm, the foreign body may enter the pericardium and even the heart, producing inflammation en route. Traumatic pericarditis with serofibrinous or purulent exudate may occur. Sometimes it may take a downward slope and pierce the chest wall near the xiphoid cartilage, forming an abscess there. At the point where the object pierces the reticulum, a localized peritonitis develops, causing adhesions between the reticulum and diaphragm at this place. The object, the sharp objects may sometimes penetrate the lungs or livers or the spleen, causing the abscesses in these organs. The penetration of a vagus nerve may result into vagal indigestion of the rumen. Grossly, the thick-walled blackish tract, which are followed by the foreign body and adhesions of the reticulum to the diaphragm, may be clearly seen. The fibrinous pericarditis with hypertrophied myocardium may be seen if the foreign body has entered the pericardium. Sequelae include, if the sharp object is not contaminated, only mechanical injury to the affected part is seen. Vagus indigestion, when the ventral branch of the vagus is affected by the inflammatory and scar tissue formed by the penetrating foreign body. Diaphragmatic hernia may occur due to weakening of the diaphragm by lesions which are produced by the foreign body. Abscesses of lungs, liver, and spleen can be noticed. This is fatal because if the sharp object penetrates any larger artery. Now, let us look at the ulcers of the forestomach. Ulcers of the forestomach may be seen cattle in occasionally, and etiologically it is due to the bacteria Fusobacterium necrophorum infection. And these ulcers may be found in the animals that are started on heavy grain feeding and also in the cows which are kept on milk. The chemical ulceration due to corrosive chemicals, and ulcers are seen in the bovine viral diarrhea. The sequelae, hepatic abscess are considered to be a complication of ruminal ulcers. Now let us come to the parasites in the rumen. Rumen of adult ruminants may contain conical flukes which may be free in the contents or attached to the ruminal mucosa. These conical flukes are nothing but the ampistomes which may be present freely moving inside the content or which are attached to the ruminal mucosa. In this image you can clearly appreciate the ampistomes, and this is the ruminal wall. This is the image of postmortem changes in the rumen, which includes bloating with gas, sloughing of the mucosa, this sloughing of mucosa, and a blackish discoloration. Now let us come to the malposition of the stomach. The first one is diaphragmatic hernia of the stomach. It may be met within dogs and cats due to automobile accidents, and the diaphragm is ruptured and the stomach enters into the thoracic cavity. Because of the automobile accident, diaphragm may rupture, that will leading to the entry of stomach into the thoracic cavity. That is the diaphragmatic hernia of the stomach. Now let us look at abomasal displacement. Abomasum may be displaced either to left or to the right. The left side displacement is more common, in which it lies between the rumen and left abdominal wall. This abomasal displacement is more commonly met with after the parturition, and the predisposing causes are atony of the abomasum due to feeding large quantity of concentrates. Post-parturient disease like milk fever, mastitis, metritis, and ketosis may also cause atony of the abomasum. The etiology include a complication of surgical treatment for the chronic indigestion. Violent activity like jumping in estrus may be a cause in non-parturient cases, and a heredity predisposition may exist. When it comes to the pathogenesis, during the pregnancy, the rumen may be lifted by expanding a gravid uterus, and the abomasum may slip under the rumen. After parturition, when the uterus recedes, the rumen drops to its normal position, displacing the abomasum. The greater curvature of the body of the abomasum, which is more mobile, which slips under the ventral ruminal sac. Atony of the abomasum due to feeding of concentrates after parturition prevent its correction. In cases treated surgically for chronic indigestion, the incisions that are made are weak spots where the abomasum may slip through. Clinically, the signs are vague, that are not any specific clinical signs are observed. These signs are like those of chronic indigestion. Due to pressure, normal function of the abomasum is interfered. Anorexia and ruminal tympani, abdominal pain, dullness, rapid loss of weight, tucked up appearance. The tongue is scanty but it is soft, and frequent abnormal tinkling abomasal sounds may be heard at the level of parallel fossa. And clinically, mild ketonuria may be present. To diagnose, laparotomy may be needed for its diagnosis. And in case of differential diagnosis, this displacement of abomasum must be differentiated from the chronic acetonia and traumatic reticulitis, vagal indigestion, diaphragmatic hernia, pyelonephritis, and lymphomatosis. Now let us come to the another pathological condition, that is torsion of stomach. Torsion of stomach may sometimes be seen in old dogs. This is because sudden movements like jumping, rolling, especially when the stomach is full. The pathogenesis with the esophagus as the pivot. The heavy stomach rotates clockwise. This is the esophagus, and the stomach of the dog start rotating around the esophagus in clockwise direction. As the blood vessels are compressed, there may be congestion and hemorrhage. The twist close both the opening of a stomach, and so the gastric tympani develops with resultant dyspnea. In some cases, stomach may also rupture. Grossly, there is a twisting of stomach around the esophagus, and the content of the stomach are bloody stained. Now let us come to the another pathological condition, that is rupture of the stomach. This occur commonly in horses, and this is due to tympanitis and dilation, and trauma, violent gastric contractions. Now let us come to the acute dilation of the stomach. This is due to excessive amount of food or gas accumulating in the stomach, overeating, especially with the grain in horse, excessive fermentation when easily fermentable foods are eaten. That will lead to the acute dilation of the stomach. And some accessory causes like incomplete mastication due to poor teeth, hard work immediately after feeding, diseases of the stomach wall, atony of the gastric musculature, obstruction of the pylorus and compression of the pylorus by lipoma in the horses and lymphocytoma in cattle. Now let us look at the pathogenesis. Overfeeding of grains leads to the increased fermentation, that will lead to the production of the gases, leading to the gaseous dilation of the stomach. That in turn put the pressure on the diaphragm and lungs, leading to the collapse of lungs and congestion. And this dilated stomach in severe cases may rupture and leading to the death of the animal. The clinical signs like stretching of stomach walls cause severe pain. The dilation of the stomach cause vomition. Grossly, the stomach is dilated 4 to 5 times its normal size. The lung is congested. Sequelae: fatal dehydration and alkalosis, rupture of stomach. Now let us come to the another pathological very important condition, that is gastritis. It is defined as the inflammation of the stomach, that is gastritis. It is fairly common condition in animals. Predisposing causes like close confinement and unsanitary conditions where bacteria thrive, contaminating the feeds and feeding utensils. Etiology like physical, feeding, chemical, and stress, bacterial, virus, fungi, and parasites. Because of these agents, there may be a gastritis due to physical agents, faulty dentition which prevents the proper mastication, foreign bodies may traumatize the gastric mucosa, and feeding very coarse material, eating bedding material, and that will lead to the gastritis, and feeding with the frozen foods, overfeeding cause dilation of the stomach. These are the physical etiological agents. Now, when it comes to the feeding of soiled, moldy, and fermented hay and silage, or feeding easily fermentable foods, or leads to the gastritis. When heavily fatty animal are fed, the feed is not easily digested, leading to the stagnates. It ferments and so it produces irritation. Too sudden change in the feed, toxic plants are responsible to the gastritis. Chemicals like uremia, that is excretion, gastritis is caused by the excretion of toxic subjects through gastric glands. The caustic and corrosive chemicals like mercury, lead, copper, arsenic, phosphorus are the responsible for the gastritis. And the stress condition like adrenaline is produced in large quantity, which is responsible for increased gastric secretion leading to the gastritis. And this is seen in nervous dogs and in cows separated from their mothers. The bacterial causes in cows enterotoxemia and colibacillosis, and in case of pigs erysipelas. Vibrio dysentery and salmonellosis and colibacillosis. And the viral causes like in case of pig, that is hog cholera, transmissible gastroenteritis in baby pigs, and in case of cattle, in rinderpest and mucosal disease, there is the normally we will see the gastritis. And in case of chicken, that is in case of Ranicat disease, which causes hemorrhagic proventriculitis. In this image we can clearly appreciate the hemorrhage over the papilla of proventriculus and the hemorrhage in the intestinal mucosa of the lymphatic tissue. The fungal causes like aspergillosis and mucormycosis, these are the main common causes of gastritis in animals. And the parasites like stomach worms, Trichostrangula species, Haemonchus cantatus, Osteotegy, and larva of parampistomes in ruminants are responsible to the gastritis. And the larva of Habronema and Gastrophilus equi flies in the horse. And in case of pig, Hyostrangulus rubidus and Ascarops strangulina, these are the common parasites which are responsible to the gastritis in pig. Now let us come to the types of gastritis. Gastritis may be acute or chronic. Acute gastritis may be catarrhal, fibrinous, suppurative, hemorrhagic, or necrotic, depending upon the cause and their severity. The most common is catarrhal type, and the least common is hemorrhagic. The pathogenesis involves in gastritis, food does not get digested, motility of the gastric wall retarded, the irritation may produce pain and vomiting. In case of catarrhal gastritis, gross pathology, gastric mucosa is covered with mucus. The mucosa is in some places may show ulceration, mucosa become thick and red. Histopathology include the mucosa shows catarrhal exudations, hyperemia and leukocytic infiltration. And some of the gastric glands may be damaged and lost. And in case of acute hemorrhagic gastritis, this is common condition, and etiology include caustic chemical poisoning, uremia, and acute infectious diseases like pasteurellosis, Braxy, and leptospirosis in dogs are responsible for the gastritis. And grossly due to hemorrhage, the mucosa is bright red in color, and the gastric contents are bloody stained. And digested food that is has acid hematin imparts a brownish coloration to the stomach contents. And in case of parasitic gastritis, this is very common in animals. Etiology, in case of cattle and sheep, it is due to Haemonchus cantatus and Osteotegy and Trichostrangulus axi. And in case of horse, Habronema larvae and Trichostrangulus axi and Gastrophilus equi fly larvae. And in case of pig, Hyostrangulus rubidus and Ascarops strangulina. And in case of cat, Gnatostoma species are the important parasite responsible for the parasitic gastritis. Now let us come to the pathogenesis. The strangles are bloodsuckers and they produce minute injuries on the mucosa of the stomach. The larva may burrow into the stomach for completion of their life cycle, and thereby they cause damage to the epithelium and glands. Heavy infestations, besides causing anemia, will produce catarrhal gastritis. Grossly, the gastrophilus species in the stomach may produce ulcers. Habronema larvae live in granulomatous nodules, which may be infected by secondary bacteria and leading to the formation of abscess. Now let us come to the another type of gastritis, that is chronic gastritis. Etiology usually the same causes as for the acute, but operating for longer time. Sometimes it may be secondary to chronic gastritis, dilation and cirrhosis. Now let us come to the pathogenesis. Ischemia in a gastric dilation and passive hyperemia and a failure of detoxification in cirrhosis decrease the local resistance, thereby facilitating the infection. Grossly, the mucous membrane is thickened and covered with tenacious, viscid, glassy mucus. This condition is usually a hypertrophic type with thickening of the gastric wall. Histopathology include there is exfoliation of the epithelium, hyperplasia of gastric gland and muscle fibers along with the cellular infiltration. The mucosa may be thrown into polypoid fold. The intestinal connective tissue hyperplasia exaggerates the mucosal folding. Occlusion of the glands result into the development of retention of the cysts. Now let us come to the gastric ulcers. These gastric ulcers are common among the animals. Small superficial defects are known as erosions. Sorry for the disturbance, which are common among the ruminants, and cows are more often affected. When it comes to the etiology of the gastric ulcers, the first one is trauma. This is the commonest cause of the abomasal ulcers in the cows. And obstruction of pylorus in cattle. In cows by foreign bodies or coarse feed, there is leading up the obstruction of the pylorus in the cattle, that is ultimately leading to the gastric ulcers. And in case of adult cattle, traumatic reticulitis and abomasal displacement. And the chemicals may act either directly on the mucosa or indirectly through their action on the nerve. The grazing on pasture heavily fertilized with the nitrogen leads to the production of the ulcers. The nutritional factors like nutritional hepatic dystrophy due to the deficiency of vitamin A in pigs. The infections, in case of infections, the erosions are common in the abomasum of cattle, in rinderpest, mucosal disease, bovine malignant catarrhal and fox disease. And fungi like Mucora species, Monilia species cause gastric ulcers in pig. And these ulcers may be because of the circulatory disturbances, nerve effects, and the parasites, and the neoplasma of the stomachs. Now let us come to the pathogenesis. Whenever animal is under stress, that will lead to the increased HCl production. The increased HCl will cause the irritation to the gastric mucosa, and that will lead to the erosion and leading to the ultimately formation of the ulcers. If it is in acute condition, that may lead to the healing, and ultimately scar formation will be there at the site of ulcer. And if it will not be controlled, and in such condition ulcers are aggravated and leading to the perforation of the mucosa of the stomach, leading to the peritonitis, and the content enter into the abdomen, leading to the toxemia and ultimately result in death of the animal. Now let us come to the grass pathology. The mucosal erosions in cattle are of the size of millet. And slowly, by the action of a gastric juice, the erosions may enlarge and become deeper to form ulcers. And these ulcers are usually demarcated, having raised borders with the punched out appearance. The base of the ulcers may be submucosa or muscular coat, or in some cases, even the serosa. And the serosa coat is the base, that is the deeper layer of the stomach. If the serosa coat is the base, there will be a high chance of perforation. And this is the image which shows the ulcers in the gastric mucosa. And This is the image of showing a perforation. The histopathologically, the erosion is covered by an exudate containing mucus, fibrin, inflammatory cells. The epithelium is exfoliated. The submucosa may be infiltrated by large number of leukocytes. Sequelae. Ulcers develop very rapidly. The abomasal ulcers develop in 3 to 4 days. The most of the gastric ulcers heal by the formation of granulation tissue. Destroyed glands do not regenerate. Healed gastric ulcers have a star-like appearance. Sometimes blood vessels may be eroded and fatal hemorrhages may be result, but this is not common in animals. This is mainly common in man. Gastric ulcers of animals rarely perforates. Perforation, when it occurs, may happen in 6 to 7 days. Hemorrhages and perforation resulting into the fatal peritonitis and are occasional complications. Lactation stress may be one of the cause of the perforation of the abomasal ulcers in cattle. Progressive anemia and emaciation may result in some cows. Perforation of stomach wall, it is mainly because of the sharp foreign bodies and because of the ulcers or because of the carcinoma. The combined effect of the carcinoma, ulcers and sharp foreign body leads to the perforation of the stomach wall. From that perforation, the content may enter into the abdominal cavity, leading to the peritonitis and ultimately leading to the toxemia and resulting in the death of the animal. The neoplasm of the stomach wall, most common is lymphosaarcoma of the abomasum of bovines. This is about the second part, digestive system pathology. In next video, we will discuss regarding the remained digestive pathological complications in part 3 of the digestive system pathology. Thank you.